Hello and good morning, everyone. I'm Dr. Hossein Khalili, the Director for Center for Interprofessional Practice and Education at the University of Wisconsin-Madison in US and also the co-founding lead of Interprofessional Research.Global. It is my great pleasure to be with you all in your second day of your fourth IP technical meetings. And today I'm going to briefly talk about the IPCP challenges and opportunities during the COVID-19 pandemic leading through COVID crisis. And also, I'm going to briefly talk about the interprofessional research that global collaboration opportunities and wrap up. First of all, I want to acknowledge that some of the content and some of the knowledge that I'm going to share today is based on the work of the COVID-19 Task Force of Interprofessional Research Global. As you all know, and also this conference is all about, so we are still in the midst of COVID-19 pandemic that's affecting every aspect of our life, and IPCP has not been an exception. At the global level, we are experiencing two major impacts on IPE. For the institutions and universities who have had the infrastructures, they managed to quickly transition their IP activities into virtual or online education. Some other university, they needed to cancel or postpone their IP activities. And based on some of the new stats, we know 30 to 70% of higher education, including for health professional educations, they had to cancel or postpone their education training for students. And due to that, millions of students have lost their valuable clinical and community educations. There are challenges with either of these trends. For those who manage to transition to online, there is still a concerns about internet access as well as digital literacy among their students, faculty, providers, and clients. Transitioning large-scale events into virtual platforms is another challenge for online IP education. The last but not least important issue with an online IP education is about how we can ensure that students still learning with, from, and about each other. And in respect to postponing and cancellations of IP activities, trends that or an observations that we have seen is that some institutions that prioritize their profession-specific education before IP and interprofessional collaborative practice, which is a concern, specifically during this pandemic that all is about collaboration and learning how to work in teams. If we look at practice and the impact of COVID-19 on practice, and questions that we could ask is about how prepared have healthcare providers been for this COVID-19 pandemic. Based on number of documentary, blogs, and research that have been done among healthcare providers, many of healthcare providers didn't feel that they have been ready or being trained to deal with such an unprecedented health crisis. We know the magnitude of COVID-19 impacts on health education and healthcare system is yet to be fully realized or close to be done. And for that reasons, it's very important that we can continue leading through the crisis. These unprecedented times really calls for unprecedented leadership. And at the same time, we know the future of healthcare and health system relies on the quality of and the collaboration among the next generation of healthcare providers. With the great work that you are doing, we can turn this crisis into opportunities. If you look at history, we know many discoveries and innovation happened during crises. For example, Isaac Newton changed the world through his discovery, innovation, and theories while he was in quarantine from London plague during 17th century. So this is our time and our opportunity to help shaping and building our dream health education and healthcare systems for the futures by leveraging on the pandemic silver lining. Here are some examples of silver lining in healthcare related to IPCP. COVID-19 have been seen as a shared experience among healthcare providers that help them to increase their interprofessional collaboration and also to develop a sense of team, interprofessional team, which help with their coping, resiliency, and also success. As another silver lining, telehealth integration become a reality. And the student involvement with the response team to the COVID-19 are some examples of COVID-19 silver lining. Please learn more about the silver lining through papers that we have recently published at the Journal of Interprofessional Care. In fact, pandemic management is an interprofessional domain, and interprofessional education and collaborative practice has never been more important than these days, as the life and death of people are at stake, and we know collaboration saves lives. Pandemic management requires a high level of coordination and collaboration among all healthcare providers, as well as at all levels of the society, as well as global community. There are mental, emotional, financial, and community-wide psychosocial impacts due to COVID that we, as healthcare providers and healthcare system and healthcare education, needs to deal with and address. Currently, more than half of the healthcare providers are experiencing some level of anxiety, depressions, PTSD, and others. In fact, we need to protect and mobilize the current and future generation of healthcare providers, and at the same time, we need to advance IPCP science and research. At a time of crisis, data collection and data analysis is part of the response. What are some strategies that we can use to address some of these challenges during and post COVID-19? Long-term planning may not be possible, but we could use agile methodology. Digital technology are here to stay, so we could utilize some of these technology as you're doing with this conference. COVID-19 is an uncharted territory, so we can try some low-risk, novel idea and models. We could combine ideas and solutions to address some of the old and emerging challenges. We could develop new processes and practices to address, or we could redefine some of the models and frameworks that are available to us in IPCP, and we are going to talk about some. Here are some thoughts for your considerations. For example, the applications of the current IP competency frameworks in an online platforms, or the assessments of IP online on students and team and practice. In addition to those, we need to start incorporating some new concepts and domains in our IPCP. Online IP is the new reality. Online IP simulation, interprofessional telehealth and e-health, interprofessional resiliency as a core concepts or the core themes for this conference, pandemic preparedness, as well as critical thinking and creativity. When it comes to IPCP research priorities, last year we have published a discussion paper on guidance on global IPCP research that outlined three main priorities for IPCP. And this year we have published a paper, an editorial to discuss the relevancy of those priorities as well as any new updates that we had. This is also a great opportunity to start thinking about establishing IPCP research centers within your institutions to help advancing the science and knowledge on IPCP. I know the COVID-19 lockdown could provide an opportunity for many of us to start working on our pending manuscripts, on conducting research that have been left behind in the past, or conducting data analysis, and or more importantly, pursuing some new ideas as a research project. And don't feel that you're alone. Partnership and collaborating with your local, national, and global IP/CP community is an important and very encouraging. And this brings us to interprofessional research.global. Last year, I presented and I talked more in more details about interprofessional research.global that has been around since 2009. And today, I'm going to briefly talk about some of the new development that we are working on. IPR.Global is a community of practice of scholars, leaders, decision maker, administrators, service users, service providers, and students. We have five working groups as well as number of task force, including COVID-19 task force that have been actively engaged in knowledge exchange and knowledge development. I've mentioned about the discussion paper that we published last year, and this has been a great collaboration with your regional networks, and Jose has been instrumental in translating this discussion paper in Spanish and Portuguese. Another great opportunity for your team and your institutions to consider is the 2021 IPR.Global Best Research Awards. We have three prestigious awards that have been named after great scholars, Dr. Huber, Barbara Brandt, and Dr. John Gilbert, who have been part of your conference today as well. So I highly encourage your team and your institutions to put forward some names for one or more of these awards. Many of you have recently received an email with respect to Global IP Situational Analysis Survey. This is a joint collaboration between Interprofessional Research.Global and Interprofessional.Global. And we hope that every institutions in your regions would participate in this global initiative. The COVID-19 impact survey that has been around since last summer. We have received great participations from your regions at time 1 data collections, and we are currently in time 2 data collections. Please ensure to participate. Here are some additional initiatives that have been undertaken by IPR.Global. We have a blog available to all regional networks to share their news, their update, as well as their achievements with the global community. Quarterly newsletters that many of you might have been receiving this quarterly newsletter. If not, please make sure to sign up on the screen. And also, if you are interested to be more engaged with the activities of IPR.Global, please submit your applications and complete the forms, and we will be in touch. To wrap up this presentation, as we discussed, IPCP is essential during this pandemic, considering the management of pandemic is by nature is interprofessional, and to manage the pandemic and also to advance IPCP, we need to utilize resiliency, flexibility, and agility as our major approaches. Here are a list of references that are being used as part of this presentation. And thank you. Thank you very much for inviting me to be part of your technical meeting, and also for listening and watching this presentation. Hope you enjoy your time.